more than 50% of healthcare providers are burnt out. It's an epidemic. And fundamentally it speaks to a broken healthcare system, because when you look at the healthcare system, 75 to 90% of all healthcare conditions that present to the primary care provider, patients presented to the primary care provider, are directly or indirectly related to stress. So patient steps into the room with a healthcare provider, only to discover they're the second most stressed out person in the room because their provider is more stressed out than they are. And on one hand, it's funny, but on the other hand, it's deeply sad, because that gets into the way of the healing intent. Patient walks in and they would deeply want to be touched. They come in with a stress-related concern, and they want to be felt with empathy and understanding in a way that helps them de-escalate and create a healing experience. Unfortunately, met by healthcare providers who themselves are stressed out, and in those moments, not from any fault of their own, but in the system with which they work, they don't have access to the empathy to care for their patients. And not only does the patient suffer, but because of that, the healthcare provider suffers too.
The fellowship has completely transformed my life. It's the only training program that I noticed that they focus on self-care, and it's really interesting because what I've seen in other kind of programs, or almost everything else, I will say, is that they focus on training, and then after people are burnt out, then people start talking about self-care in a very minimal way, and it's too late.